Let's turn to health matters. Today is World Malaria Day, and the World Health Organization is calling on governments of nations to step up their level of commitment towards the eradication of the disease, which is responsible for millions of deaths annually. Senior correspondent Jacqueline Ogo takes a broad look at malaria, the spread, and the need for multiple interventions.
Malaria is a life-threatening disease known for killing millions annually, especially in tropical Africa. But it is a treatable and preventable ailment. It is transmitted by the female Anopheles mosquito, which carries the malaria parasite scientifically known as Plasmodium. When mosquitoes carrying the malaria parasite bite people, they transfer Plasmodium into the bloodstream, and such persons fall ill with malaria as the parasite attacks the life-giving human red blood cells. There are 5 types of the malaria-causing parasite. Doctors say amongst them, Plasmodium falciparum and Plasmodium vivax cause deaths when not successfully treated. World Health Organization statistics say in 2021 alone, 247 million cases of malaria were diagnosed globally. 619,000 people died same year of the disease. 77% of that figure were children under the age of 5. Nigeria accounted for 31% of the 2021 global malaria death record. The country is still battling with major factors which promote the spread of the disease, like dirty environments with uncleared bushes near residential apartments, stagnant water where mosquitoes lay their eggs and multiply. They breed faster during the rainy season. This is an area of Lagos State where mosquitoes are giving the people nightmares. They are crying out for help.
There's stagnant water here, and mosquitoes have been breathing here. So many things have been happening here. It has been laying egg, causing malaria to the children. Everyone here is not safe. As you can see, everywhere is just the water is so dirty, it's stagnant. The water is not going. So we need the government to just help us to do this road. The children here, their life is not safe here. Mosquitoes breed here, so it lays egg and causes malaria for them. So the time they are meant to spend in school, they are not in school. They spend it in the hospital. Their parents are going out to look for what they will eat, and when they are in the process, they are still coming back home to meet their sick children at home, spending money on them again.
The water is very, very dirty, and you can see mosquito laying egg, perching on it. We people that are staying here, it really affects us. The thing usually perch on me, and I do not like it, and I'll fall sick. And I do not like the mosquitoes drug that they give us, that malaria drug. I do not like it.
Apart from the fact that malaria is prone, very prone. I mean, thick, good, big mosquito are biting people. If I'm in production department, for instance, and I'm at home for 1 week, 2 weeks, 3 weeks, what happened to that production? So if there's nothing to produce, what happened to the inflow, the cash inflow? If the cash inflow is not there, what happened to this, the standard of living? So it's just a ripple effect it is going to have. But if everybody is fine, I can work at my optimal output. Yeah, I can give him more.
Doctors say for governments to reduce malaria burdens, tackling underlying environmental factors must be given topmost priority. There's also another key warning for the reduction of malaria death rates. Doctors say the most dangerous way to tackle malaria is through self-medication. They insist on medical consultation.
Every medication people take without doing it the right way on the prescription, using the right dosage, has a tendency of destroying organs, especially liver. So you can't just take anything anyhow. Usually things we see as symptoms. It is very important to see a doctor to find out the underlying cause of the symptoms, because 2 sicknesses can actually have same symptom. So are you sure it's malaria you have? You need to do proper tests to know, to have the diagnosis right.
Who controls the drug people go out to buy there? I know that the pharmaceutical aspect of healthcare is doing a lot in regulating the drugs that are sold to our people. But now I can still walk to, a pharmacy and request for some drugs and buy and just go away.
The World Health Organization wants to see malaria eradicated, But these cannot be achieved without the cooperation of nations. And in line with finding solutions, in 2019, Ghana joined Malawi and Kenya to launch a malaria vaccine implementation program targeted at the vaccination of children in 42 districts across 7 regions of the country. In February 2023, the country launched an expansive malaria immunization program, which is expected to deliver malaria vaccines to children in 51 additional districts. In Nigeria, doctors help prevent malaria deaths through the use of prophylaxis, which is a combination of tested and reliable malaria drugs. The WHO is encouraging more nations to actively join the search for lasting solutions. Malaria is more common in tropical Africa. This means the governments of the region must holistically tackle the disease to ensure the death burden is drastically reduced. Jacqueline Ogo, TVC News, Lagos.
And for more on the efforts by governments to eradicate malaria in the world, let's bring in Dr. Agbo Ebuta, the Vice President of Medical Initiative for Africa. He joins us live via Zoom from Abuja. Good to have you join us, Dr. Agbo. I want to begin from where one of the doctors in that report we just saw left off. She was talking about the implications of self-treatment, and I want to start from there. Talk to us about the severe forms and cases of malaria in the country, and then the challenge and implication of self-treatment.
Well, thanks for having me. Malaria cases in Nigeria are about 97 million based on the 2021 data. That means half of the Nigerian populations were affected. In terms of death rate, we lost about 200,000 Nigerians to death in 2021 and contributed 31% of the global burden. Now, the issue with treatment is that I can tell you for free that most of the people who treat malaria do not have malaria. Because for you to treat malaria, WHO recommends that you should test before treating. Because most people who have fever, headache, or any symptom would go to the pharmacy or chemist and get an anti-malaria. Studies have showed repeatedly and consistently that half of those patients or more do not have malaria. Even patients who have flu, cough, and catarrh will treat for malaria. Now, this has led to several things. Number one is that it has exposed people to medications that they do not need. That's number one. Number two is that it has exposed them to potential adverse drug reaction, like my colleague mentioned, liver, kidney, and other challenges, and even allergic reactions. Number three is that it has also taken these medications when you think you are treating for malaria, delays proper diagnosis and treatment for what you actually have. Number four is that it increases the events and the emergence of resistance to anti-malarial medications, as we are beginning to see, because the abuse of anti-malarial medications lead to due exposure of the parasite and the emergence of resistance, and as we have demonstrated in Nigeria, and evidence continues to emerge. So it's very clear that there is an overuse of anti-malaria due to an unregulated sector, and that has delayed proper access to treatment. Be that as it may, that is not to undermine or understate the challenge of malaria in Nigeria. The current data suggests that 22% prevalence in Nigeria. That would put a number of about 50 million Nigerians at any point in time would have malaria. Unfortunately, this number of people, most of them would not get access to treatment due to cost, access, or the absence of a supportive health system, especially as a result of a weak primary healthcare system. All these are significant challenges and will require, just like this year's Dr.
Ebuta, just sorry to interrupt you. I wanted to ask you, because you're speaking on something quite important and interesting, which is a malaria burden. And yes. I was going to ask you, in line with the theme of the year, which is time to deliver zero malaria, invest, innovate, and implement. And if we're to deliver zero malaria in Nigeria, where should we be investing in? What should we innovate? And then what should we implement?
Well, innovation has to be in the prevention, in the diagnosis, and in the treatment of malaria. Number one, in prevention, we must be more aggressive. Local government chairmen, state governors, and of course the federal government would have to do more, especially local government chairmen. They must improve environmental sanitation, drain all water bodies that are prone to malaria colonization, and expose these water bodies and environment to the use of insecticides and larvicides as necessary. In addition to that, they must provide access to diagnosis and treatment. Diagnosis will require that proper diagnosis using microscopy, and where not available, rapid diagnostic kits, which have been approved by WHO. And finally, there should be medications. The use of insecticide-treated mosquito nets should basically be encouraged. And more recently, innovation in terms of the availability of the R21 vaccine. The R21 vaccine is very interesting. It has the potential of preventing malaria up to 77% within a 1-year period if you take the complete dose in children who are between 3 months and to 3 years. And these are the people that are most affected. But the advantage of that is that if we were to institute it mathematically, if we look at the metrics, if we do that within the next 1 year, we can drive malaria prevalence from 22%, as we have in Nigeria right now, to 5% only from vaccine intervention. And then we can then knock off the remaining 5% with other measures. In addition to that, we need to increase investment. And most of the investment for malaria now is very uncoordinated, but the one that is tracked and there's data for is usually foreign investments from donor agencies and all of that. But that is insufficient for us to put together to target elimination. So investments must come from local sources, they must be sustainable, and we must
All right, thank you so much, Dr. Agbo Ebuta, the Vice President of Medical Initiative for Africa, who joined us live from Abuja.